You have a question? Yeah. Yeah, we still have time.
Thank you to my colleagues for convening this critically important hearing today. And thank you to our panelists for your testimony this morning. Ms. Broth, Ms. Bush Holcomb, and Dr. Ellison and Ms. Higgins Freeze for taking the time to be with us today. Last week, I was here in this room and shared stories from my own constituents in Oregon's 6th District. And today I look forward to hearing from you. And it is so crucial that we do put a real face to the millions of Americans who could lose their health care as a result of the Republicans' cruel health care cuts. And my question is for Jackie. What we heard this morning, because of your ACA healthcare, you are able to really continue to operate your small business, knowing that you have health insurance. And my question is a two-part. First of all, what portion of your budget it is comprised of healthcare? So, of your housing, your groceries, and your healthcare, what portion is healthcare? And then what would it mean for your small business if you lose your ACA coverage? What tough choices will you and your husband be forced to make between your livelihood and your health?
I would say healthcare. Give me an average number, 20%. If I calculate and I crunch the numbers, 20%.
So it's a large portion.
That's all of healthcare combined into one. Prescriptions, premiums, so 20%. And then the second part of your question is if we were not to be able to afford our premiums, what would that do to us?
And what kind of decisions would you have to make?
Well, again, we've had the discussion, and this is my family alone, and there's many, many out there having this discussion right now. So it's my husband and myself, and we have had the discussion on not knowing what our premium will be. So if it triples, we cannot afford it. So at that point, I would do my due diligence and shop around and probably get a plan with less benefits, higher deductibles. Maybe I might save money in the premium. It would take a lot of research and a lot of work on my end. I'm starting back at the beginning again, where I was years ago when I lost my job and we lost our insurance coverage through my employer. So it would be devastating for us. So that 20%, we're not in a financial position for that to go up to, 50% of our income for healthcare. 20% right now is expensive for us.
Do you pay taxes?
Yes.
You pay taxes.
Yes.
This
Yes.
is part of what you pay into. And the Affordable Care Act is not something that is free. We all pay taxes. This is health care that you pay for. This is not a freebie.
We have paid into
the system
since we have been working.
Thank you.
And we will continue to do so.
And you're
whether we have health insurance or not.
And you run a business that pays into your local economy.
That
So
is correct.
thank you. Thank you for running that business. Thank you for supporting your community. And I hope we can continue to afford, and I hope the Republicans come back, lower the cost of healthcare for all of us so that we can make sure that you stay in business, that you and your husband can afford healthcare, that you can remain well, that you can keep working and offer your community the services that you offer now. So thank you so much for being here.
Thank you for listening to me.